Hailey McKee, come right on down. The Price is Right.
Thank you, Bob Barker.
Yeah, it's that works. Bob Barker meets a Family Guy. So
Right.
we're just going to keep this going. The theme tonight, obviously, is civil liberties, and I'm so grateful you took the time to come out on a Friday night. I know you've got a commitment later on this evening.
Grateful to be here. Thank you.
So let's talk about your organization. And I get horribly lost on all the words. It's the attention span is far too much for me. But it's the Substance Use Policy, Education, and Recovery PAC,
You got it.
of which I am proud to be a member.
Thank you, Pat.
I think my membership is probably up. I probably have to renew. But
We don't even have a membership. We actually don't have a membership. But
Okay.
That's
Okay.
You're a member.
Right. So I'm only going to speak for a minute, and then I'm going to turn it right over to you. But your organization is at the meeting point of so many important issues. Stephen Brown alluded to it. The great Stephen Brown alluded to it when he was on earlier in the show, and when he talked about the need to foster recovery, not criminality, to act in support of individuals who are willing to face life's challenges, particularly those ones who are willing to meet it head on, and that we don't need to. Society neither gains from nor do individuals benefit from the incarceration, the criminalization, essentially, of human behavior. If handled properly, the only quote-unquote victim, the only person suffering, is the person who is deep in the stages of addiction, and it certainly needs our support, not the guns, literally, of the criminal justice system being waged at them. Your organization, too, is focused on political repair, if you will, of a system that's clearly gone mad over the last couple of years. And so
More than a couple of years, but yeah.
But in certain respects, it's getting worse. So bring us up to date, if you will, on Kristen's Law. You folks also have an event coming up next week. I want to say that if you go to this event, there is going to be, I guess, a silent auction. I am donating an hour and a half of showtime to anyone who wants to bid. You folks will handle the mechanics of the bidding, but you'll get an hour and a half of programming time. I have to be here. I don't have to be with you on the set. Okay. I'll be behind the curtains.
That's awesome.
But you can, within the bounds of basic decency, and anyone who knows me, those are pretty wide bounds, but within the bounds of decency and basic family laws, no cussing, that person can cover for an hour and a half whatever subject.
I might have to bid on that one.
Well, whatever they want. You'll get the video in a YouTube format. You'll get the podcast in an MP3 format to use as you wish, to reuse as you wish. And all in all, someone can have a lot of fun, and they can have their own news show for an hour and a half.
Thank you.
So
Very gracious.
No, it should be a lot of fun. So
Thank you.
Bring us up to date on what's going on with the laws. You guys came out with a pretty bold statement today, and then we'll talk about the event.
So, as far as what's going on with the laws, Kristen's Law has had a little bit of a reemergence. For people that aren't in the know as far as what Kristen's Law is, that is our drug-induced homicide law that was put into effect about a year ago at the very end of last legislative session last year. And that kind of went out with a bang. It was received with a lot of opposition, and yet it still passed. So one person was charged with the law back in the fall, and there's been, unfortunately, a string of tragic overdoses in our city of Providence as of the first week of July. And the Providence police have chosen to respond to those overdoses by outwardly stating that they're investigating them as homicides because now they have this great new toy called Kristen's Law. And we have an issue with Kristen's Law because of the fact that it deters people from calling 911 in the event that they witness an overdose out of fear of some sort of retribution if somebody doesn't pull through. That's at the core, that's our biggest issue with Kristen's Law. Additionally, I can say as a former drug user, I used heroin for years. I used a multitude of other substances. And on any given day, if I had passed away at some point, I honestly couldn't tell you what substance would have been the one that had broken the camel's back. And to put 100% of the blame on any one individual for engaging in an activity which is essentially a consensual act when you're buying and selling illicit substances really doesn't honor a person's life after their death, and really doesn't quite capture the whole picture of substance use disorder, which is just a very complex sociocultural issue and a public health issue, not a law enforcement one. So we've recently responded to the Providence police major's comments, which we feel are very overzealous and not quite what Kristen's law was supposed to be utilized for when it passed. I know the folks over at the governor's office and the attorney general, the new attorney general's office, have stated that this is a tool in their toolbox that will only be used in the most egregious cases where they are able to pinpoint a drug dealer who is doesn't have any contact or relationship with the person that's passed away and is knowingly putting fentanyl in their product, which of all my years doing drugs, I didn't meet that person, but if there's one out there, that's fine too. But so we've responded to Kristen's law, so everything in the last year has kind of come back around again. We would idealistically like for the law to come off the books. Realistically, that's probably not a possibility, but working back in the State House this past session, a lot of different lawmakers that voted up on the bill and voted in support of passing it have confided in me, and I'm talking, there were a great number of them that have approached me and have told me that they voted to pass the bill under political coercion or just circumstances, and they're actually trying to make good on it. So we're back. We came back, formed a political action committee that was basically born from the drug-induced homicide bill last year because we saw a need for lawmaking that was based in evidence, based in public health, and was rational. That wasn't that didn't generate laws out of emotional reactivity, which is what we've seen a lot of, whether they're good or bad. So the three of us, Anna Jane Yolkin, who is our founding father, who couldn't be here today, myself and Lisa Peterson have been working on drug policy pretty steadily for the last year. We've been in the State House every single day this session, and we've seen some pretty promising things, some terrible things. We had overall a dismal session, and it's been back to Kristen's law this week, so it's all kind of come full circle. But there was a lot of in between there as well. So.
To your point about repealing the law, it's interesting because I'm trying to think of a repeal movement of any, like a publicly waged repeal movement of any law, and I'd have to go back to the reinstatement of the Good Samaritan Act. To me, that's almost textbook because there were a whole lot of different people who came from a whole lot of different backgrounds there who said, you know what, this is idiotic. We need to reinstate this law, and so if that's a model, I think there is an appetite. I think the two most interesting characteristics are if you listen exclusively to the news cycle, and from the great public perspective, and you're not immersed in the issue like you are, or you don't follow it closely like I do. The public perception right now is that somehow. And I'll use an old Shirley Temple movie. Do you know who Shirley Temple is? Okay. Yeah. Well, Shirley Temple at one point in one of her movies came out, and it was in the middle of, one of her. They're really racist if you look at them. But at the time, I was a kid. This is the '60s. There was one movie I just remember so clearly that in the middle of this dirge-like tale of sorrow about life in the Deep South. All of a sudden, Shirley breaks through that third wall and comes out and announces onto the stage and everybody, "Hey, everybody, the Depression's over." And at which point in time, the curtain is pulled back, and to the tune of this is true, to the tune of "Happy Days Are Here Again," an entire Busby Berkeley-style production dance number happened, and the world was better. And that strikes me that the media, the mainstream media, has all of a sudden come to the conclusion that the opioid crisis is somehow over because they've decided it's over. They're not getting enough clicks out of it. They're not, government officials have spoon-fed them that is over. Is the opioid crisis over?
Here's the thing about the opioid crisis, and no, it's most certainly not over, to answer your question. So in Rhode Island, we currently have about 10,000 people that live in our state, our friends and neighbors, that are on medically assisted recovery, such as Suboxone or methadone. And there's an estimated other 10,000 people that are struggling with opioid use disorder that do not have access to medication or are not currently on these medications. So it's most certainly not over. I think, however, I think that we've kind of gotten away from the issue, because substance use disorder is substance use disorder as a whole. So we're seeing a lot of bad bills passed out of Capitol Hill or Smith Street that are center focused on the opioid epidemic, wherein it's really a substance use disorder epidemic as a whole. So it's most people, from my experience, myself included, have what's called polysubstance use disorder. So not only are we using opioids, but we might also be using alcohol, we might be using cocaine, and all of these things are exactly the same. So it's just whatever substance you're using is just a symptom of something that's going on that's bigger. But unfortunately, the opioid epidemic has driven a lot of bad policy. Even the policy that looks good on the surface, and we saw a lot of those bills passed this year, it essentially doesn't do anything, or it works against people. It's not saving lives. So, and we saw a lot of bills this year that were great bills that didn't pass, that would have saved lives, that would have made a difference, and a lot of bills that essentially did nothing. And when I say nothing, I mean it really didn't move the needle at all, that passed with flying colors, because they feel good on the surface.
Of the ones that didn't pass, what clearly the gold standard is repealing Kirsten's law. Not
really. So
okay.
Kirsten's law, like Steve Brown had just mentioned, we set out as a political action committee to try to put good laws into effect that were going to improve the lives of our neighbors and friends here. We weren't so much set on Kirsten's law. As a matter of fact, we tried to start this session with a blank slate, so we could get back on the right foot with some of our lawmakers to see where there was potential there. And we were actually very pleasantly surprised at what we heard from our lawmakers. There was an overwhelming sense of compassion. These people wanted more information. There was a drive to help people and look for solutions. Unfortunately, there's barriers that come higher up, but I can tell you, working with these people firsthand and being in that building almost every single day, that almost every single one of our lawmakers are looking for answers on how to help people, help their constituents. They care, I hate to sound cheesy, but it's the truth. We were very pleased from what we heard from all of our lawmakers, both on the House and Senate side this session. Unfortunately, there's some systematic flaws that most of the bills never hit the floor. They never get out of committee. Right. And some of those bills, to answer your question, were some of the ones that would have really clearly made a difference was our baby, which was the reclassification of simple drug possession charges, which is defelonization. That's something that we were working on for quite some time. The Attorney General kind of took it over and championed it back in February or March. That bill did not pass, despite the fact that I can tell you with 100% assurance that it would have passed by probably about 90% on both sides.
If it made it to the floor.
If it had made it to the floor, no doubt. Our lawmakers were overwhelmingly in favor of it. Other states have seen really positive results with that law. As a matter of fact, half the states in our country have made the move to reclassify simple possession charges. There has been no uptick in crime. It has seen fiscal savings in our neighboring Connecticut of $12.7 million a year last year. And that's a charge that, it was interesting. I listened to the House Speaker on a program just yesterday or the day before, and he was speaking about the problem with the IGT that they're currently having. And he had mentioned a number that really stuck out in my head, and that was 1,100 people that were potentially out of jobs if that company were to pack up and move out of our city. And that's almost exactly the same number as the amount of people who are charged with simple possession of illicit substances in Rhode Island annually. As a matter of fact, last year it was 1,111 people were charged with possession of an illicit substance, not distribution. This is possession. This is a symptom of a medical condition. And those are 1,100 people that I can tell you with full assurity are not going to be able to find employment going forward, because a felony charge is a barrier to employment, education, and housing. But those are 1,100 people that nobody's advocating for. This was a bill that felt good. It had two solid sponsors. The Attorney General had created it, and it died. It died. It didn't even see a House or a Senate floor vote. Additionally, there were bills for, a pilot to a study commission for a safe consumption facility, which actually passed in the Senate and didn't see a House floor vote. But again, that's another evidence-based bill that would have really put us in line with the gold standard of care in Rhode Island for substance use disorder. Another bill to decriminalize buprenorphine, which is Suboxone, which would have certainly saved lives. Again, passed the Senate, did not see a House floor vote. To remove pre-authorization for medically assisted recovery so people could get in and access treatment on demand when they needed it. Did not see a floor vote. But what did pass, amazingly, was, and a couple of these are bills that we testified in favor of because it was like, why not? They were harmless, was granting law enforcement protection in cases where they had to administer Narcan or naloxone as first responders, which they already have those protections in place. That was a feel-good bill that did absolutely nothing. Signage on prescription counters, such as CVS, that warn the public as to the potential dangers of opioids, which messaging is always good, accurate messaging is good, but again, I'm not sure that it's going to really move the needle or save a ton of lives. Another bill that passed, this was my favorite one, actually. This was the House Speaker's bill that initially extended or reduced the initial prescription to 7 days for an opioid for a prescriber. So a medical prescriber for a narcotic script, such as any sort of opioid, it would have capped it at 7 days. But the problem was that it was already currently capped at 5 in the Department of Health, mandated. So what the Speaker had essentially done, because the office didn't do their homework, was extend the prescription time for what's called morphine milligram equivalent, or MME, from 20 to 28, which would have been another 2 days worth of doses. And statistically, that would have put a lot of people at risk, because we know that it only takes 5 days for people to become dependent on these medications. So, fortunately somebody caught it. The unintended consequences.
Yeah. Just continues to run wild.
Right, so somebody caught the mistake, so they passed a law that limited prescriptions to 5 days, so essentially doing nothing. So that is what we did as, what the General Assembly was allowed to do this session to help this epidemic along. Yeah.
Wow. Yikes, as they say.
And I think most notably, as fantastic and sensational as Kristen's law is, the ball got dropped the most with the reclassification of simple possession bill this year. That's something that we worked very hard on. A lot of people were excited. It was overwhelmingly supported, with the exception of one entity, and that was the Police Chiefs Association. So they are the group that is responsible for the racial disparities in racially profiling and targeting a population of people when people use the same. They were our absolute adversaries this whole entire session. And to be completely honest with you, I think they're our biggest roadblock as far as pushing policy that has anything to do with the war on drugs, which is a war on race and class. Everybody uses the same, but for whatever reason, we're targeting communities of color. It's been that way for decades now.
Right.
Yeah.
No, I'm with you 100% on that. I'll let the cynic in me bubble over. I won't put you on the spot with this, but my contention would be that simply those kind of laws are bad for business, that there's an enormous amount of money to be made, facilities to sponsor, equipment to be gotten, overtime to be paid for. If you can continue the war on drugs, and by reclassifying the basic offenses that they use to catch people on as just a way to get them into the criminal justice system, if those two words aren't antithetical to each other. I can see that. I can see that happening in the state. That same organization is a roadblock to a significant level of criminal justice reform that needs to take place in multiple arenas.
And we've heard from our community partners that they basically essentially blocked racial profiling bills for 10 or 15 years. And they're the people that are executing, this systematic problem and this huge injustice. And the fact that they're allowed to the table to weigh in on these issues is mind-blowing to me, because it's a public health issue. Even the Cheeto has acknowledged that this is a public health issue. So while law enforcement is allowed
the Orange Julius,
it's been kind of embraced here. We have, we're at a perfect point here where we have the support of an attorney general, a public safety commissioner, the governor's office. The state police have been really essentially very helpful. I mean, they've had concerns around surveillance, but overall they're pretty good on substance use disorder. Everybody's making gains in the right direction, and the police chiefs, every time I turn on my television, it's the crackdown, or it's just and
well, it's time to crack down on them then. These are organizations that largely, unless you're again immersed in the issue, largely operate under the radar. Organizations like the police chiefs or League of Cities and Towns and all that, some good, some bad, aren't well known to the populace.
Right.
And they don't know the extraordinary clout that they have up on Smith Hill. They've been a pervasive force, my understanding, in continuing to try to fight the continued implementation of medical cannabis. They've used their authority to try and find cracks in the wall, privacy, if you will, for medical cannabis patients. I mean, it's they sponsor a reefer madness mentality that unfortunately probably pervades your world as well as medical cannabis.
We see it all the time with fentanyl. So they'll often report fentanyl overdoses on behalf of their first responders, and we know that that's not true. We know that you can't absorb fentanyl and overdose through your skin. And we're not sure what's going on there, but they change their story. So you give them data or information, and they'll modify it. They're like Teflon for data. They'll come up with something publicly like fentanyl exploding purses, or the perpetrator threw the fentanyl in their faces, just to kind of suit the narrative. And it's been very, very challenging. We tried to land on a weight with these people to try to pass our bill by the end of the session, and it was currently at 28 grams. We tried to compromise at 14 in cases where there weren't fentanyl, and then it came down from there. And I had tried to bargain down with the director of the Police Chiefs Association, and they wouldn't even hold at 5. And this was after they had testified on the record on both the House and the Senate sides in support of this reclassification bill. But they were holding the ball when the time ran out, so hence there's no bill this year. And predictably, another 1,100 people will be charged with felony possession this year, and between this year and next. And because of our law enforcement is so systematically racist, an overwhelming number of those people are going to be people of color, and despite the fact that everybody uses the same. So white people and black people are using substances at the same rate. So this injustice will just go on in perpetuity until somebody puts their foot down and boxes the police chiefs out of the conversation, which is my hope for this legislative session coming up.
Well, reach out to the public at large and let us know how we can do that, because we're certainly no fan of them here. And just a recurring number of issues, even unrelated to this. They are the law enforcement mentality run amok. And there's this notion, ironically, of them being just sort of hovering above the law and, essentially putting out there their own personal law enforcement agendas in direct contradiction to what's been determined by many to be good public policy. Is just really disgusting.
Yeah. And on a ground level, we hear, I see stories, I've heard stories where they're not willing to assist in cases where a person's overdosed because they don't have naloxone on them because they didn't do their due diligence to carry it, or they're unwilling to administer it because they're not comfortable with it, because the person's overdosed before. They're not looking at this issue objectively. I've heard from people firsthand, police that have told me, and this is municipal police, this is not state police, that have told me that they wish that they let a couple of people pass and set an example for the rest of the population. And that's what's going on our streets. I had a friend who was working with somebody who was having some sort of medical emergency, unsure if it was substance use related, but the person was trying to make their way to the ambulance, and the officer said, if you don't get on the ambulance faster, if you don't start walking faster, I'm going to arrest you. And that is what's going on our streets. So not only do we have things going on where they're thwarting policy, but on a ground level, it's not good. It's not good. And when they use their mouthpiece and come out and speak as though they want retribution and this crackdown, and they're vilifying it, really silences people that are living with substance use disorder and shames people. We go back into the shadows, and we're less inclined to ask for help. We're scared to call 911 in cases of overdose. It's not conducive towards anything positive. And they're not taking tips from everybody else around them, from the public health sector, from like, as I had said, the people that are working on safe stations, or all of these wonderful programs across the state. In a lot of cases, these are coming from law enforcement. And it's just, from the police chiefs, it's just been more of the same. So.
We've only got a couple minutes. You have an event coming up this week.
Yes. Oh, well, August 15th. Yes.
August 15th.
Yes.
Tell us about it.
Well, it's our political action committee's first birthday party. It's going to be at Layali, which is on Weybosset Street, Thursday, August 15th at 5:30. It should be a good time. It's
just down the street.
Just down the street. Yeah, just down the street. It was. We had a good crowd last year. A nice mix of. Nerds and lawmakers and science and law, and it's a great group of people. So we hope to see all of you there to support. We're going to be coming back around next session, and we've got a lot of great ideas. We'd like to hear everybody else's ideas as far as what they'd like to see to improve drug policy and other related issues in Rhode Island. We'll be working hard over on Smith Hill next year and trying to get that bill up and going again next year. Hopefully it will pass. That will make have a huge impact as well as those other things. So
no, it's a great opportunity to network if you're looking to meet people in a wide variety. This is one issue that's so universal within the activist movement that it brings out activists of all stripes, beliefs, persuasions. There was a number of state representatives last year that would have astonished even the most casual observer because of the disparity in some of their beliefs on other issues. It really is an issue that should bring together every Rhode Island.
And it did. It's truly a non-partisan issue. The feedback that we got from our lawmakers was so overwhelmingly good this session, and it wasn't a Republican issue, a conservative, Democratic issue, a progressive issue. Everybody universally really wants to get on board with this and help, because I think that part of the reason is that everybody in the state is affected, and that doesn't exclude our lawmakers. And we were really impressed by what we heard in that building this session. Overall, we didn't get any feedback that, even when people might have disagreed on a point, they were actually asking questions. What is fentanyl? What is this? What is that? And we were able to meet in the middle, because I think at the end of the day, people don't want to see people dying. No, and yet that's what's happening. So
this is a community filled with fundamentally decent people who really only want the best. We're a tribal little place. We can mess with each other, but you can't mess with us. And it's a loving, supportive community. And despite our political differences, this is one of those issues where you check them at the door, and you just some of the solutions that you folks are promoting. There's so much in active public life that you won't see the results of for years. This is literally, in certain issues, a break glass, instant improvement in the quality of life of people who have been dramatically affected by substance issues, that you get the benefit of that little glow when you see something actually work. And that to me is just tremendous. It needs to happen. And to the degree that the Attorney General continues to fulfill our expectations.
And he's been great. He's an advocate. When he gets up and speaks about this, he sounds like one of us. So I can't. He's been extremely helpful with this issue.
Excellent. So what is the website?
We are, I don't know, it's on my shirt somewhere. Can you read the back of my shirt? I forgot what it was.
OverdosePreventionPAC.com.
That's us. Yeah, or we're this, yeah.
That's pretty damn straightforward. Yeah. So it's a great event, lots of fun. There is going to be a silent auction. Us and all sorts of people are going to contribute items. So it'll be an opportunity to have just a great time for a fabulous cause. And congratulations on if there's ever a tendency to get down based on legislative results, the education that you folks have brought to the table to a lot of people who have been mired down by urban legends and myths and confusion and chaos and shame and all that, the light that you folks have been able to shine on that in just 1 year is astonishing. That's why I wanted to make sure you came back to the show.
We're just getting started.
Just getting started. That's what we want to hear. All right.
Well, thank you, Pat. I appreciate it.
Thank you so much for joining us tonight. All right. We're going to take a very quick break. We're going to get on to another issue that I'm sure Hailey's on board with. We are going to have an organization, conservatives concerned about the death penalty, folks who are actively working from a different side of the aisle that you might suspect to oppose and to end the death penalty. Folks, we are the Coalition, loud and proud, outrage porn-free, civilly disobedient media broadcasting live on the Worldwide Coalition Network. Facebook.com/The Coalition Radio, on the Mighty Mighty Twitter at Coalition_radio, and of course the mothership at coalitionradio.us. Hannah Cox is joining us in just a minute or two. We're going to take a quick break. We'll be right back.